Hi everyone, welcome to the Healthee Minute. I'm here with Elle Meza, startup advisor and former people operations executive. Great to have you here.
Thanks to have me.
Yeah, it's great to have you here in New York. Great to have you here in our New York office. Let's start with some warm-up questions, okay? So, what works better for you, San Francisco or New York?
Oh gosh. Well, I left my heart in San Francisco. My family is there. I was born and raised there, so.
I feel there is but coming.
Yes, but when I'm alone and no one's with me, New York is super fun.
Do you have any special place that you must go when you're in the city? Any special New York drink?
Oh yeah, well, all the drinks. Always a gin gimlet up with Hendrix. But I really enjoy just being outside on the streets with people. So it's fun to have a mix of locals and tourists. So I walked here this morning and it was lovely and very Christmassy. So it was fun.
Yeah.
It was fun.
Best time of the year.
Yeah, the holidays.
All right, cool. Tell us a little bit, how did your career start?
Oh, what's funny is I actually started in theater and film. So my background is that my very first job out of college where I studied theater and film was for George Lucas. And I worked on the prequels of, his big series. So I really enjoyed it. He also paid $5 an hour because that was minimum wage back then. So I was like, I can maybe do something more than this. And I got a job in insurance and, it was boring, but I learned really quickly and did well. And insurance turned into consulting, and consulting went into in-house HR. And I loved it. I was helping people, I was doing good work, and I figured out that that's what I was meant to do.
I think it's super fascinating, and I think that it's super important for people that are people-oriented, right?
That's right.
All right, great.
I have deep empathy, so anything I can do to help people is a great job for me.
Amazing. Now, be honest, do you ever get tired of talking about benefits?
I don't. I think, the thing is, benefits change all the time. So it's never the same conversation over and over. And I think people care deeply about their own benefits, their communities. So there's always something to talk about, and I can find an angle that someone won't be angry with me when I have this conversation. But a lot of my benefits conversations are around fixing healthcare because it's complicated.
True, and you see a lot of companies, right? You're startup advisors, and can you name one, I would say, most common mistake that companies do when they deal with health benefits to their employees?
Yeah, I think that they take things straight out the box. So I think especially when we see organizations go from fully insured to self-funded, they don't take the opportunity to really design a program that's right for their employees. And partially it's because they're not listening to their employees and what they really need. So my favorite thing to do when coming into an organization is really help them do a listening tour, understand what their employees need, and then from there go on and build one of the best benefits programs out there.
Interesting. All right, you have thousands of followers on LinkedIn. Are you going to add to your role, to your title, LinkedIn influencer anytime soon?
It's funny. I was laughing with my family and saying, I should put more videos up because I talk a lot on LinkedIn, but it gives me time to really be thoughtful and edit. I think that if I decide someday to switch and start, doing quick videos and little tidbits and shares, maybe I will. We'll see. Right. Follow me.
Yeah, you should. You are also a troop leader, right? And a cookie parent for Girl Scouts?
I am, yes. I've got 3 girls.
We've done our research here.
I love it. Yes, I have 3 girls. They're all in the Girl Scouts right now. I'm a troop leader. I'm the cookie mom, which means I'm very organized. And also, if anyone needs cookies, it's almost that time of year.
And which Girl Scout cookie is the best?
If you put them in the freezer, the Thin Mints are the best. But straight out the box, I like the shortbread cookies. I'm just saying. Yeah. It's controversial. I know, they're the plainest ones out there.
It definitely opens the appetite for everyone here in the room. All right, cool. One last question. What advice would you give to organizations when preparing for a new year? With benefits, open enrollment, things like that.
Yeah, I think raise your hand and ask for help. It's complicated, so your employees need help. You as the employer and the person managing the benefits need help, and you don't have to do it alone. You've got a broker potentially that has a solution that can work for you. You can work with Healthee.
Right.
There's going to be a lot of questions. January 1st through about the 30th, maybe even into February, employees will forget what they signed up for. Right. They'll forget how it works or what changed. It's overwhelming, so ask for help.
That's I would say golden advice.
Thanks.
For sure. Now we're going to move to the quiz section. So question number 1. What percentage of private industry workers in the US had access to medical care benefits as of March 2024?
Oh, I mean, I want to say 100%. Probably not true. I would say that like 85 to 90%.
Close.
Oh,
Yeah,
okay.
it's 72%. It's 72%.
Oh God, it wasn't
Yeah.
close, and that's depressing.
That's depressing.
All right,
Totally
okay.
agree.
I'm more hopeful.
Question number 2.
Okay.
All right. As of 2023, what percentage of U.S. private sector employees worked somewhere that offered health insurance?
Oh, I mean, again, I want to say 100%. It's private sector, they're working there. I'm going to go with the similar answer. I think 85%.
It's a little less, it's 79%.
Wow.
That's still depressing.
Welcome to America.
Yeah. We love America.
Yeah.
What is the most commonly cited reason for employee turnover in the United States?
Ooh, well, my gut says I hate my manager. But probably, I would say feeling stagnant, like not being able to develop and grow in your career.
You are absolutely right. That's perfectly the answer. Awesome. Thank you so much. It was great to have you here.
Glad to be here. Thank you.
Thank you. Bye-bye.
Thanks, Ella.
Bye.